Welcome to the deep dive. Today we're digging into canine chronic hepatitis. If you're a dog owner, this is probably something you've maybe heard about, or perhaps you're even navigating it right now. It's actually pretty common, but well, can feel really complicated.
It really can. And we know your time is precious. So our aim here isn't to read you a veterinary manual. It's more about pulling out the really key stuff. We want to give you a clearer understanding of what's going on when a dog has this condition without getting totally lost in the weeds.
Right. We've gone through some really solid source material that covers, what it is, the causes, how vets diagnose it, and the management side of things. Think of this as your shortcut to getting a good handle on canine chronic hepatitis.
Exactly. Our mission is just to make this complex topic a bit more digestible. By the end, you should hopefully feel you know what it is, maybe why it happens, how it's spotted, and what the options are.
Okay, sounds good. So let's start right at the beginning. In simple terms, what is canine chronic hepatitis?
Okay, so at its core, it's basically ongoing damage to the liver. And this damage is driven by inflammation that just, well, it sticks around. The source material we looked at really stresses that this isn't like a sudden flu bug for the liver. It's a slow, gradual process.
Hmm.
And the inflammation itself involves specific types of immune cells. You're looking mainly at lymphocytes, plasma cells, macrophages. It's not really the neutrophils you'd expect with a typical acute infection.
So it's not like the liver's fighting off a bacterial infection in the standard way.
Precisely. And this kind of chronic, ongoing inflammation causes some pretty major changes in the liver over time. You see the liver trying to heal itself. It forms these little lumps, regenerative nodules.
Okay.
But unfortunately, it also leads to fibrosis. That's essentially scarring. And if that scarring keeps progressing, it can eventually lead to cirrhosis, which is, a very serious stage where the liver structure is severely damaged and it really struggles to function.
That does sound serious. The material mentions something interesting, that the body's own immune system can actually make things worse. How does that work? Seems a bit counterintuitive.
Yeah, that's a great point. It does seem backward, doesn't it? What happens is when the liver gets injured initially, could be from anything, a toxin, an infection. Maybe we don't even know the cause. The immune system jumps in naturally to clean up the damage and start repairs.
Right, standard procedure.
But in chronic hepatitis, this immune response sometimes it doesn't switch off properly or it becomes a bit misdirected. So instead of just dealing with the initial problem, it starts damaging healthy liver cells too. So the body's attempt to help actually ends up contributing to the ongoing damage.
Ah, okay, that makes more sense now. So there's an initial trigger and then this kind of runaway immune response. Can we talk a bit more about how that damage actually happens inside the liver? Like what's going on at the cell level?
Sure. The source mentions a couple of key mechanisms. One is oxidant injury, basically, unstable molecules damaging the liver cells, their membranes, the little organs inside them.
Right.
Another interesting point is where in the liver the damage starts. It's not always random. Sometimes the location gives clues to the cause, like damage near the portal triads, that's called zone 1, is often seen in idiopathic cases where we don't know the exact cause, whereas damage in zone 3, which is more central in the liver lobule, that might point towards issues like copper accumulation or maybe certain drugs like NSAIDs or even problems with blood supply.
Huh. That's fascinating. So the pattern matters. What happens then as the damage spreads?
Well, it progresses. You get those inflammatory cells infiltrating the tissue, leading to, piecemeal necrosis, basically liver cells dying off bit by bit in those affected zones. And over time, this chronic inflammation fuels the development of that fibrosis, the scar tissue.
Okay.
And the scar tissue starts forming bridges, connecting different areas of the liver lobule that shouldn't be connected, like portal areas to central veins.
And that scarring is bad because
It disrupts
things.
Exactly. That fibrosis, along with those regenerative nodules trying to pop up, completely distorts the liver's normal architecture. Think of it like a city grid getting all messed up with roadblocks and weird detours. It really hinders the liver's function.
Makes sense.
And eventually, this can progress to cirrhosis. The blood flow through the liver gets messed up, and you can also get cholestasis. It's where bile flow gets blocked.
Right.
In the late stages, it all adds up. Significantly reduced liver function, and something called sinusoidal hypertension develops.
Sinusoidal hypertension. Sounds like high blood pressure.
Yeah.
But specifically in the liver.
That's a really good way to think about it, yeah. It's increased pressure in those tiny blood vessels, the sinusoids, within the liver. And this pressure has knock-on effects.
Like what?
Well, it makes it harder for blood from the intestines and spleen to flow through the liver. So pressure builds up in those vessels too. That's mesenteric and splenic hypertension. To try and relieve that pressure, the body sometimes creates new abnormal blood vessels, little shortcuts. Acquired portosystemic shunts, or APSS, we've heard that term.
Exactly,
Yeah.
APSS. And these shunts cause big problems because blood bypasses the liver's filtering function.
Right, so toxins don't get removed.
Precisely. Toxins that the liver would normally handle can then build up in the bloodstream, reach the brain, and cause neurological signs, that's hepatic encephalopathy, or HE.
Okay.
The pressure changes also contribute to fluid leaking out into the abdomen, that's ascites. And the high pressure in the gut vessels increases the risk of bleeding there too.
Wow, so it really does spiral outwards and affect the whole body. Speaking of which, apart from the liver itself, what other systems tend to get hit by chronic hepatitis?
Yeah, the source lists quite a few. Obviously, the hepatobiliary system, the liver and bile ducts is ground zero. You get the inflammation, the cell death, necrosis, the bile flow issues, cholestasis, and the scarring fibrosis.
Makes sense.
Then the gastrointestinal system often shows signs: vomiting, diarrhea, poor appetite, and like we just said, that portal hypertension can cause the ascites and potentially GI bleeding. Okay. And neurologically.
Hepatic encephalopathy is the big one there, especially as the disease gets more advanced.
What about the blood? Any changes there?
Yes, the hemic system, the blood. Those shunts, the APSS, can sometimes lead to smaller than normal red blood cells that's called microcytosis. And because the liver makes many clotting factors, you can see bleeding tendencies or problems with coagulation, especially in later stages.
Any impact on kidneys or urination?
Sometimes, yeah. Dogs might start drinking more and urinating more, PUPD, vets call it. And their urine might become really dilute, what we call isostenuria. Plus, if those shunts are present, you can sometimes find specific crystals in the urine, ammonium biurate crystals.
Okay. And just overall metabolism. Energy.
In really late-stage liver failure, the liver can struggle to maintain blood sugar levels, so hypoglycemia or low blood sugar can become a risk, especially if the dog isn't eating well.
Right.
And finally, maybe breathing. If there's severe ascites, that fluid pressing on the diaphragm can make breathing faster or more difficult. Fluid actually in the chest is pretty rare, though.
Man, it really is a systemic problem. So thinking about which dogs get this, are certain breeds more prone, or is it more about age?
Definitely breed predispositions. The source really highlights several. Doberman pinschers pop up frequently. Labrador retrievers, Westies, West Highland White Terriers, Dalmatians, often linked to copper issues in some of these.
Okay.
Also Cocker Spaniels, Standard Poodles, Maltese, Skye Terriers, the list goes on. So yeah, while any dog can develop it, these breeds seem to show up more often.
Is there a known genetic reason for some of them? Like the copper thing?
Yes, exactly. The classic example is the Bedlington Terrier. They have a specific inherited defect in copper metabolism, and there's actually a genetic test for it now. That's a clear genetic link.
Good to know for Bedlington owners. What about age? When does it usually appear?
Typically, diagnosis happens in middle-aged to older dogs, say average 6 to 8 years old, but the range is pretty wide. The source says anywhere from 2 to 14 years.
And male versus female, any difference?
Doesn't seem to be a consistent gender link across the board, no. Not for chronic hepatitis in general.
Okay, so middle-aged, certain breeds, definitely things to keep in mind. Now, what about spotting it early? What subtle signs might an owner notice first?
Yeah, this is tricky because the early signs are often really vague. Just not quite right. Maybe the dog is just less energetic, sort of lethargic. Maybe they're a bit picky with their food or losing weight slowly. Occasional vomiting. Just generally seeming a bit off color or having a poor coat. Sometimes increased drinking and urinating can be an early sign too, but none of these scream liver disease specifically, you know.
Right. Makes it hard to catch early. Do the signs get more obvious later on?
They often do, yes. As the liver damage worsens and complications start, the signs tend to become more specific to liver problems. You might notice jaundice, that yellow tinge to the gums, skin, or the whites of the eyes.
Okay.
The belly might start to look swollen because of ascites fluid. And in more advanced stages, you could see those neurological signs of HE confusion, stumbling, staring into space, maybe even seizures in severe cases.
What about during a vet check? Even before tests, what might a vet pick up on during the physical exam?
Well, they might notice that lethargy, the poor body condition or weight loss, maybe the dull coat. Jaundice might be visible, or maybe not, especially early on. Feeling the abdomen, the liver itself might feel normal, or sometimes enlarged, or actually small and knobbly in later
So
stages.
variable liver size.
Yeah. Later stage findings would definitely include detecting that a site's fluid or noticing the neurological signs of HE. Very rarely, you might find evidence of those ammonium biurate stones causing issues, but obvious bleeding isn't usually something found on the physical exam itself.
Got it. So it often subtle early, then more pronounced later. Let's talk causes.
Yeah.
What actually triggers this chronic inflammation?
The source lumps them into a few broad categories. There's chronic necroinflammatory injury, ongoing cell death and inflammation. There's oxidant injury, which we mentioned. And then there's immune-mediated injury, where the immune system is really driving the bus.
Okay. Can we get more specific, like infections?
Sure. Things like canine adenovirus type 1, though less common now with vaccination and leptospirosis, are potential infectious triggers. There's also some suggestion that chronic bacterial infections coming from the gut, maybe related to inflammatory bowel disease, could play a role.
Interesting.
And oddly enough, the source even mentions accidental injection of the intranasal Bordetella vaccine as a rare reported trigger.
Wow. Okay. What about the immune side? That sounds complex.
It is. It could be true autoimmune hepatitis, where the immune system just mistakenly attacks liver cells. Sometimes a positive ANA test might point towards this. Or it could be more like an acquired sensitivity, where the immune system becomes reactive to liver components, perhaps after some initial insult.
And toxins. We mentioned copper already.
Definitely. Copper-associated hepatopathy is a big one, especially in those predisposed breeds. But many drugs can also cause liver injury, either predictably or as a weird individual reaction. Things like certain antifungals, sulfa antibiotics, phenobarbital used for seizures, NSAIDs like carprofen. The list is quite long. And don't forget environmental toxins like aflatoxins from moldy food. Chronic exposure could contribute.
So it could be one big hit or lots of little hits over time?
Pretty much. And then there are things that might not directly cause it, but could increase the risk.
Like what?
Well, the source mentions things that stimulate the immune system, even questioning if vaccinations, in some rare cases, could trigger it via molecular mimicry, where the immune response accidentally targets liver cells that look like the vaccine antigen.
That's a complex idea.
It is, and it's not definitively proven, more of a theoretical risk factor being considered. Also, that copper buildup we talked about, it might cause changes in the liver proteins, making them look foreign to the immune system. Too much iron, maybe from supplements, is another potential factor. And drugs that mess with liver enzymes or antioxidant levels could also play a role.
It really sounds like detective work is needed for diagnosis. How do vets actually figure out it's chronic hepatitis, given all these possibilities and vague signs?
You nailed it. It's often a process of elimination. You have to rule out other things that affect the liver, acute hepatitis, those congenital liver shunts babies are born with, liver cancer, pancreatitis spilling over, other causes of portal hypertension or jaundice.
Okay.
But the source is really clear. A liver biopsy is ultimately essential for a definitive diagnosis of chronic hepatitis. You need to see what's happening in the tissue itself.
Right, but what tests come before the biopsy? What are the first steps?
Usually starts with blood tests and urinalysis. Blood work might show things like mild anemia, maybe those small red cells if they're shunting. White cell count can be up, down, or normal. Often protein levels, especially albumin, are low in chronic cases.
And liver enzymes.
Liver enzymes like ALT, AST, ALP are usually elevated, sometimes significantly. Bilirubin might be high if there's jaundice. BUN, glucose, cholesterol can be variable, but if they're all low, it can suggest poor liver function, maybe heading towards failure.
And the urinalysis, what does that add?
It can show if the urine is dilute, which the kidneys might do in liver disease. It can detect bilirubin spilling into the urine, and again, if shunts are involved, you might see those ammonium biurate crystals.
Are there other, more specialized tests?
Oh, yes. Bile acid tests are a key one to assess liver function. Ammonia levels or tolerance tests can also be done. Clotting tests, PT, APTT, are important because the liver makes clotting factors, so prolonged time suggests significant dysfunction.
Okay.
If there's a site's fluid, analyzing that can give clues. Measuring liver zinc levels can be informative, often low in chronic disease. Testing for infectious diseases like lepto, maybe an ANA test for autoimmune clues. Sometimes special stains on biopsies look for specific bugs or cell types.
So lots of lab clues. What about imaging, x-rays, ultrasound?
Definitely important. X-rays might show a small liver late in the game, or reveal the ascites fluid, maybe even those bladder stones. Ultrasound is super useful, though.
I saw.
It gives a great view of the liver's size, texture, whether it looks lumpy or irregular. You can assess blood flow with Doppler to look for those acquired shunts. It easily confirms the sites, can spot gallstones or masses, and crucially, it allows guided fine needle aspirates or biopsies.
Right.
In some places, they might do scintigraphy, a nuclear scan, which is very sensitive for detecting shunts, but it's less common.
And you keep coming back to the biopsy as the definitive test. Why is it so critical?
Because it's the only way to see the actual pattern of injury at the microscopic level.
Hmm.
Is it inflammation? Where is it? How much scarring is there? Are there regenerative nodules? Are there features suggesting copper or an immune attack? It tells you what kind of chronic hepatitis it is, how severe it is, helps guide treatment and prognosis.
Makes sense. How do they usually get the sample?
A simple needle biopsy can sometimes miss the mark or not get enough tissue. The source really favors laparoscopy keyhole surgery.
Why is that better?
The vet can actually see the liver surface, look for subtle nodules or shunts, and take multiple targeted biopsies from different liver lobes and any abnormal-looking areas. This gives a much more representative picture, and while they're there, they can take samples for bacterial culture and for measuring metal levels like copper, iron, and zinc.
Okay, so the biopsy paints the microscopic picture. What are the pathologists actually seeing under the microscope?
They're looking for that specific type of inflammation, lymphocytes, plasma cells, macrophages, often clustered in those zones we talked about, like around the portal tracts or in the center of the lobules. They assess how much bile backup cholestasis there is. They look for dead liver cells, necrosis.
Oh.
And critically, they stage the amount of fibrosis, the scarring, and note if regenerative nodules are forming. The specific pattern where the inflammation is worst, the type of necrosis, the fibrosis pattern, can point towards immune-mediated versus copper-associated, for example. And eventually, if it's widespread fibrosis, distorting everything with nodules, that's cirrhosis.
Right. So diagnosis is definitely thorough. Once you have that diagnosis, what's the plan? Can chronic hepatitis be cured?
Usually, no, unfortunately. The source makes it clear that treatment is mostly about control, not cure. Slowing down the disease progression, managing the symptoms and complications, it's typically lifelong management.
Right.
If a dog comes in really sick, they might need to be hospitalized initially for stabilization and diagnostics. But for many stable dogs, management happens on an outpatient basis at home.
What does that supportive care involve?
Things like IV fluids if they're dehydrated, correcting electrolyte imbalances. If there's ascites, a low-sodium diet is key. Sometimes water-soluble vitamin supplements are given. Managing ascites also involves rest and diuretics, usually drugs like furosemide and spironolactone.
What if the fluid gets really bad?
If it's causing breathing problems or major discomfort, the vet might perform therapeutic abdominocentesis, basically, draining the fluid off with a needle.
What about lifestyle stuff? Activity, diet?
Generally, keeping them warm and rested is good. Less activity might reduce liver inflammation and fluid buildup. Good hydration is important. Diet is huge.
How so?
You need adequate calories and protein to stop muscle wasting. Protein restriction is only needed if there are signs of hepatic encephalopathy or those specific urine crystals. Otherwise, a good quality, balanced, digestible diet is best, often fed in small, frequent meals.
Okay.
Sodium restriction if there's ascites or low albumin. A good vitamin supplement, but without copper if copper is the issue. Thiamine is often added. If they won't eat for a long time, feeding tubes or IV nutrition might be needed.
Sounds like the owner's role is massive here.
Absolutely crucial. Owners need education about the chronic nature, the potential ups and downs. Flare-ups can happen. Regular vet visits for monitoring blood work, checking for side effects, adjusting meds, that's essential.
Right.
And managing expectations is important too. There aren't loads of definitive studies on exact drug combos in dogs, so treatment is often tailored based on experience and principles from human medicine.
You mentioned surgery isn't usually a direct treatment for the hepatitis itself. What about those acquired shunts?
Yeah, trying to surgically tie off those acquired shunts when there's underlying cirrhosis is really risky and generally not advised. Also, anesthesia itself is riskier with cirrhosis, so careful planning is needed if surgery for something else is unavoidable. So medicine is really the mainstay.
Okay, let's talk meds then. What are the main categories used?
First, if there's an underlying cause you can treat, you do that, like copper chelators to bind excess copper or stopping a drug that might be causing the problem.
Makes sense.
Then, to tackle the inflammation and immune response, you use immunomodulators. Prednisone or prednisolone are common starters, usually tapered down over time. Sometimes drugs like azathioprine or mycophenolate are added, but they need careful monitoring for side effects like bone marrow suppression.
Okay. What else?
Ursodeoxycholic acid, often called urso, is used a lot. It helps bile flow, protects liver cells, has anti-inflammatory and antioxidant effects, might even help slow scarring. It's kind of a multitasker.
What about drugs specifically targeting the scarring, the fibrosis?
That's the million-dollar question. Some of the immunomodulators might help indirectly. Supplements like SEM, silibinin from milk thistle, vitamin E, PPC, polyunsaturated phosphatidylcholine are often used, hoping they have some antifibrotic effect alongside their antioxidant or supportive roles. Colchicine is sometimes mentioned, but it's a bit controversial.
And just general liver support, hepatoprotectants?
Yeah, many of the same players. Urso, vitamin E, semi, silibinin, often given with PPC to help absorption. Antioxidants are key: vitamin E, zinc. SAM helps make glutathione, a major internal antioxidant. Just be careful with vitamin C if copper or iron levels are high.
Got it. How about managing the secondary problems like stomach issues or ascites?
For gut protection, maybe reduce ulcer risk. Vets might use H2 blockers like famotidine or proton pump inhibitors like omeprazole. Sucralfate coats the stomach lining. For ascites, it's the low sodium diet plus diuretics, maybe fluid drainage. There's some experimental work on other drug types like vasopressin antagonists for really stubborn fluid. And HE management is a whole topic in itself, focusing on gut toxin reduction.
Are there drugs that are definite no-nos?
Generally, yes. NSAIDs are usually avoided risk of gut issues, kidney effects, potential direct liver toxicity, and you try to avoid other drugs that are heavily processed by the liver if possible, just to reduce the load.
And precautions with the meds they do use.
Definitely. Diuretics can cause dehydration or electrolyte problems, potentially worsening HE, so monitoring is key. Steroids increase infection risk, can cause GI upset, muscle wasting, and doses of other drugs metabolized by the liver might need adjusting because the sick liver doesn't clear them as well.
It really is a balancing act. So looking long-term, what's the prognosis generally like? What should owners expect?
Long-term involves close monitoring at home, watching appetite, energy, weight, and those regular vet checks with blood work and urinalysis, maybe every month, maybe every few months if stable. It's about tracking progress, catching drug side effects, looking for complications like infections or stones.
What are the big complications to watch for down the road?
HT can definitely be a recurring issue. Sepsis, overwhelming infection, is a serious risk. Bleeding can become a problem if clotting factors drop too low. And in very end-stage disease, DIC, a catastrophic clotting disorder can happen.
Is it usually a steady decline or more variable?
The source says it's often cyclical, periods of stability, then flare-ups where the inflammation spikes again, may be shown by rising liver enzymes. Some dogs, especially the copper cases, if managed well, can go into long-term remission.
That's hopeful.
It is. But developing ascites is generally a sign of more severe disease and often means a shorter survival time, unfortunately. Those dogs might need more intensive management, maybe occasional hospital stays. Getting ascites under control takes real dedication with diet and tweaking diuretics.
This has been incredibly informative. Thank you. So just to wrap up the key takeaways for everyone listening, what are the absolute must-know points about canine chronic hepatitis?
Sure. I'd say, 1, it's chronic, meaning long-term and progressive liver inflammation. 2, it has varied causes: infections, toxins, immune system, sometimes unknown. 3, diagnosis is complex and really relies on that liver biopsy. 4, treatment is about control and lifelong management, usually involving diet, supportive care, and medications like immunomodulators and hepatoprotectants.
Perfect summary. It's so clear that understanding this is vital if you share your life with a dog. Thanks again for breaking it all down. And for you listening, as we think about all these different triggers and the body's really complex reaction, it makes you wonder, doesn't it? What new research directions, what future breakthroughs might finally give us more targeted, maybe even curative therapies for this challenging condition?
That's the hope.
The science is always moving forward. We really hope this deep dive gave you a much clearer perspective on canine chronic hepatitis. Please join us next time as we tackle another important topic.